Hi, my name is Amy.
Hello, my name's Ishmael.
Hi, I'm Christy.
And we're all students here at the University of Arizona College of Nursing.
Next month we'll be graduating from the nursing program and we're really excited.
We're here to share with you some tips on how to be successful in nursing school.
Organization and time management are very important to nursing school. My biggest tip when you're starting is to get organized and to prioritize. So it's really important to know your due dates and to plan ahead and have those due dates mapped out so that you can decide what is your biggest priority on any given day and start with that, because you're not going to be able to accomplish everything, in a short amount of time. So you really have to plan ahead and, like I said, prioritize. So choose the thing that needs to get done on any given day.
One thing is to keep a calendar or a planner or something, whatever works for you, to use that. So I had a month-by-month calendar and would jot down everything from the syllabus in there so I could see the big picture. And then I'd try to take one day at a time where I knew what I could prioritize for that day. And then kind of take it one day, and then you kind of look at a week, and then you can look at a month, and then you can look at a level, but trying not to overwhelm myself, just taking it one day at a time, but knowing how to pace myself for what this is similar to as kind of a race where you have to have endurance and also kind of do some little sprints in between.
My best tips for studying and preparing for tests is something called space review. And space review is basically my strategy of studying, and it's been proven. Before going to lecture, I pre-read my lecture. Right after lecture, I review. I also recorded the lecture, so I would listen to it. And then make sure that I'm staying on top of the material on a daily basis. So by the time the exam comes, I don't need to cram everything at once because I have taken little chunks of it on a daily basis, and it's worked really well for me.
Doing a study guide was very helpful for me. So taking that large lecture and large reading and condensing it down into maybe a one-page handwritten for myself worked well because I could make a connection as I'm writing. And having that one kind of synthesized page of information for a larger section of information was helpful. So then when it came time for the test, I would have a pile of study guides that I could review, and that was very helpful for myself.
One of my big ones was to always make sure that I had planned breaks within my studying time. So making sure that I wasn't getting too tired, getting up, stretching, walking around, take your dog for a walk, anything like that to just give your brain a break is really important. Then also trying to find a buddy is often helpful. Every test is a little bit different. Anytime you're doing a skills type of test or practicing for skills, it's really helpful to have a buddy. And I think the same goes for the lecture exams as well. And then lastly, I like to do practice questions. So I think nursing tests are a little bit different than anything I've had before. So it's really important to practice those types of questions, there's Kaplan resources, there's all your different textbooks that you can use for different exams. So practicing questions is really helpful as well. I think balance is the key word in stress management. You have to find a way to let the stress not overwhelm you or take over. So whatever it is outside of nursing school that makes you happy, finding that and making time for it. So family support, your friends, maybe you're not going to have as much time as you always had before nursing school for everybody, but it's still important to reach out to those people and have fun with them because it's a huge stress relief. And then, finding time for other things that make you happy, whether it's exercise, yoga, meditation, all of those things can really help to balance your life and the stress that you might have during nursing school.
And also scheduling time to enjoy the program with classmates.
Yes.
Remember, we went to Sabino Canyon, we hiked together, just so that we can deal with it and look forward to going through the program together.
Yeah.
I think that really helped.
So your choices outside of nursing school are definitely going to impact how you are in nursing school, and healthy lifestyle is a really big part of being successful in nursing school. So I am a big proponent of taking care of your body in a lot of different ways. One being healthy diet. So it's important to stay balanced with your diet, just like staying balanced with stress or anything else in nursing school. So it's important, like I said, to eat healthy foods, to not, everything in moderation. It's nice to have a treat every once in a while, and to allow yourself that is really great. But to just be aware of what else you might be doing that could be harmful to your body. So, and also exercise is really important. Making sure that you're taking care of your body, like I said.
I agree with you. In terms of healthy lifestyle, for me, a big part was sleep. If I wanted to cover the amount of material that I needed to cover, I had to make sure I got enough sleep. And one thing that I use is a smart alarm clock that I have where, it records how many hours of sleep I get a night. And let's say I'm studying, I go home, I spend time with family, and then I want to study some more. Maybe I feel like taking coffee, but then I'm a little tired, Initially, I would push, but then I realized that if I would go to sleep, get my 7 hours of sleep, wake up early, maybe like 5, study those 2 hours before school starts, I would get 10 times more done than I would if I took coffee and tried to stay up for another hour or 2. So really, sleep was big for me. Making sure I get at least 6 to 7 hours of sleep a night was really, really big for a healthy lifestyle.
I agree.
Healthy lifestyle is very important, especially during nursing school. We are entering a profession of nursing where we are teaching others about being healthy and living healthy lifestyles. So it's important that we live up to that and take care of ourselves. And in order to take care of others, we need to take care of ourselves. So I agree with all of you. Sleep, exercise, eating. I had to actually block out time for studies, but time for exercising as well, because if not, if I didn't block it out like a class, it would get filled with other things. So I had to block out that time. And then also just being aware of other coping mechanisms that might not be healthy. It's not the time to start, trying to stay up late and do things with other ways. We need to really take care of our bodies and listen to our bodies as well in order to perform well in the classroom and also be the best nursing student and eventually nurse to our patients.
The college offers many resources, both the U of A and the College of Nursing. And one resource that really worked well with me was having time to work with the learning specialists here in the College of Nursing. And when I started the program, I did a prep program called VARC, which is it looks at what style of learning works best for you, be it visual, be it reading, auditory, kinesthetic, or multimodal. And after looking at that, I found a way that works best for me. I'm more of a kinesthetic person, so I read the lecture and then I write my notes. So really making time before you even start the program, meet with the learning specialist, see if you can do this program, and then go on. It's a really good resource that worked for me.
As far as resources, there are a lot available. I also utilize Learning Specialist for paper writing, and that whole aspect of APA and things like that. That was very helpful for me. And another huge tool that I used was the medical library. That was a great resource. It was my home away from home. I got to know the library staff there. They're very helpful as far as helping to find articles as resources, technology issues with logging in, getting a room just to study and have a nice place to study, and having a whiteboard to use, and books that I could check out to supplement my learning. So the library was a great tool and should be utilized by many. It's awesome.
So I also would recommend turning to your classmates for help. So they're a great resource. Everyone studies a little bit differently. Everyone might have a different level of expertise. So going to them for help is always really helpful. Ask your instructors. If you're really not understanding a concept, try to ask them to explain it, in a different way, perhaps, and just engage your instructors and ask questions if you're not understanding.
Another thing too is the Silk Lab. To tap into that resource, there's open lab times, there's extended hours, everything you can check with the Silk Lab themselves, but that's a place to practice skills and to just take advantage of the equipment that's here. So utilizing that as well is a great resource in making others aware that that is available is also helpful to your classmates. It's meeting great people, great classmates, people that have come from all different backgrounds, different ages, different walks of life, different everything, but bringing all their skills and uniqueness to the program. It's just been awesome meeting these people and seeing how much we've grown in such a short amount of time, and that is just encouraging. And it's also really exciting for the future of nursing, the future of healthcare, to see all these people that are very passionate about taking care of people, providing amazing patient care, patient-centered care, all these things, that we are on the same page and moving forward. And it's exciting also to look at the healthcare as a whole. The College of Nursing does a great thing with the College of Medicine and pharmacy and interprofessionalism, that we are shaping now the future of healthcare. And so that's been awesome, and meeting great professors and hopefully carrying on our friendship with our classmates wherever our future takes us, and maintaining those relationships as we start our career in nursing, and the opportunities are endless. That's what's exciting about looking forward.